Let's talk a little bit about fluoride. Fluoride is the source of a lot of questions in the dental office. So we can learn a little bit about what fluoride is, what it accomplishes, why we use it, and even when we use it, and hopefully answer some of those questions for you. Again, this is the type of topic where if you have concerns or questions, don't be afraid to ask your dentist or your dental hygienist. They'll be happy to explain to you the products that we're using, the concentration of those products, and what the reason for using them is. But let's start with what fluoride is. Fluoride is a naturally occurring mineral. It's found basically in rocks all over the planet. And what happened was about 100 years ago, scientists started to notice that people in certain areas of the country had brown spots on their teeth. And it was kind of a curious reason why, and they weren't sure where these brown spots were coming from. These patients, even though their teeth were stained brown, had significantly lower rates of cavities and dental problems than the general population. And so it became apparent pretty quickly that these two things may be connected, and we began investigating kind of the source of both the brown spots and the source of the protection wherever it was coming from. The chemistry around what fluoride does to the teeth or your bones is not super important, but I like to use the analogy of a home for patients to help them understand exactly what's happening in fluoride. Our teeth are kind of lattices or almost crystal structures that are comprised primarily of calcium with some proteins mixed in the middle. The best way to understand this is to think about a home. And if you strip all the drywall off of the walls, you'll see the studs or the wooden structure of the house kind of organized in a way that holds everything together. And this is a lot like the calcium in our teeth. It forms a grid or a pattern that gives some strength or rigidity to the tooth. In our mouths, when we eat things that are acidic, foods high in acids like tomatoes, lemons, sodas, teas and coffees, wine, etc., they have the ability to actually pull calcium out of our teeth in real time. So as you drink and eat acidic foods, calcium is plucked out, and this would be the equivalent of every time you walk into your house, you open up a wall and you pull a stud out. Now, the good news is that there are some natural things in our saliva that help deposit calcium back into the teeth. So as you pull a 2x4 out of the wall, someone is following behind you and putting a new one in. And this process is an exchange between calcium in your saliva and calcium in your teeth that basically ensures that your teeth maintain a certain level of hardness and resistance to problems like cavities. When we don't have proper diets, we have less calcium in our saliva, and we don't replace all the 2x4s as we pull them away. What fluoride does, fluoride takes the place of calcium in this lattice, but because of the way that it could bond to or interact with things around it, it creates a much stronger grid or frame to your house. And so the analogy here is that if I open up the wall and pull a calcium wooden 2x4 out of the wall, and I replace it with a fluoride, this would be the equivalent of replacing it with a steel beam in place of a wooden beam. And the steel is a little bit stronger. And so if you went around your home and every fifth or sixth piece of wood you replaced with a piece of steel, you could imagine just how profoundly this would improve the strength of your home, the rigidity, the resistance to damage from wind and things like that. This is exactly what's happening in your teeth. Fluoride is essentially taking the place of calcium in the tooth and allowing for a stronger lattice or network structure that makes the tooth more resistant to breakdown in the future. Obviously, too much fluoride, as the case with the initial community in Colorado, created brown spots or fluorosis, and too little fluoride didn't allow enough of those steel beams to be placed to protect anything. So over the years, we were able to kind of dial in and figure out what is a safe amount of fluoride to improve the structure of our home without damaging the look. Obviously, if we tore out all the wood and replaced it with steel, your house might look a lot different. So we don't want people to know that we have steel in our home, but we want the benefits of that steel. And what we found is that about 0.7 parts per million is a perfect amount of fluoride in water to create benefit in the teeth and the bones even, without discoloration or other problems associated with excess fluoride. And this amount has gone up and down a little bit over the years. There are a lot of places in the United States that naturally have much more than 0.7 parts per million. And there's actually a lot of communities throughout the United States that actually reduce the amount of fluoride in their drinking water by removing it. Most municipalities, that is large cities that use water treatment to create drinking water, their drinking water may not be coming from natural sources. Here in Columbus, we have water treatment, which means all the water that's flushed and disposed of essentially gets cleaned and sent right back to us. That amount of fluoride in that water is monitored, and in the cases where the fluoride content is suboptimal, they'll add, and sometimes they may even have to remove fluoride in order to dial us in at that 0.7 parts per million. The most important kind of time for exposure to fluoride to receive the benefits is for children. And that's because kids as young as about 6 months old actually already have small buds in the bone where the grown-up teeth are beginning to form. If you have fluoride present as the teeth begin to grow, it essentially is building a house with steel in certain places, and those teeth come out of the mouth stronger than they otherwise would have. Up until about the age of 16, exposure to this fluoride is critical in developing strong and healthy teeth moving forward. In addition to children, there are also some reasons why young adults, and elderly people should have exposure to fluoride as well. It's very easy to think, oh, I'm a little bit older and I don't need those benefits anymore. But the truth is, fluoride has the ability to remineralize or augment existing teeth in a way that helps prevent cavities. And in addition, fluoride is actually a little bacteriostatic, which is fancy talk for it just slows down bacteria and can inhibit the growth of bacteria in certain places in the mouth. So it kind of helps keep us clean as well. Now, some of the reasons why adults would consider fluoride both through drinking water or supplements of fluoride at the dental office. If you have existing dental fillings or crowns, restorations like veneers, those are all things that are more susceptible to cavities than healthy regular teeth. Patients that have active or previous history of gum disease or periodontal disease, patients with recession or bone loss can benefit from fluoride applications. And probably the most important one that we see is patients that are xerostomic. And what xerostomia is essentially a sciencey word for dry mouth. And the clinical condition of dry mouth or xerostomia can often be a consequence of a number of things. But if you've ever watched a commercial on television for a prescription medication, nearly everyone lists dry mouth as a possible side effect. It's one of the highest side effects of all prescription drugs, but particularly the drugs that are prevalent in our societies. Medications for things like diabetes, high blood pressure, cholesterol, antidepressant medications, all cause xerostomia or dry mouth. And if you think back to our discussion about what fluoride is and how it helps us, if we are dry in our mouths, we don't have enough saliva, and that means in that process where we're plucking the 2x4s out of our wall, we don't have the saliva following behind us to help reinsert boards where we took them from, and the teeth can become softer. Softer teeth are more prone to breakdown from things like new cavities. We see a process called recurrent decay happen frequently, and that's cavities that form around existing dental crowns or fillings. And these processes can happen very quickly and progress very quickly. And it can be really demoralizing for an older patient who spent a lot of money on dental work in the past. They might have several crowns and old fillings, to find out that a lot of the work that they had done previously is no longer effective in their mouth because we have new cavities forming underneath those fillings or crowns. A lot of those problems can be attributed to dry mouth, and so supplementing our body with some additional fluoride, either through the drinking water or some of the ways that we'll talk about from the dental office, can offer an added layer of protection by reinvigorating the teeth with that fluoride ion that makes things just a little bit stronger and more resilient to cavities and breakdown. But in modern day society, sometimes we're not exposed to quite the quantity of fluoride that we maybe used to have been. If you have water filtration system at your home, like reverse osmosis, that's going to pull between about 50 and 95% of the fluoride out of your water. Even something like a Brita filter, an activated charcoal filter in your refrigerator or in a pitcher, can pull about half to 2/3 the fluoride out of the water. A lot of us drink bottled water. Many of the bottled waters on the market use reverse osmosis to purify the water, and again, that pulls most of the fluoride out of the water. Additionally, products that use water in their manufacturing used to use municipal sources of water, sodas, drinks, even foods with water in them. But now a lot of the manufacturing process filters the water prior to making the products, and so those products no longer have fluoride in them in the same concentration that they used to. The only distinction I'll make is if you have a water softener at your home, generally water softeners do not affect the fluoride concentration. But having said that, our intake of fluoride as a population is down for some of these reasons. And so making sure that we supplement can be a good idea, particularly if you fall into one of those categories. If you're a child between the ages of 6 months and 16 years old, if you have existing dental fillings or crowns, if you have things like periodontal disease or bone loss, or if you're taking prescription medication, those can all be great reasons to add fluoride basically to the system of your mouth in order to help keep your teeth strong and healthy. Okay, so in addition to fluoride in the water, one of the ways that we can add fluoride to our mouths is by getting fluoride treatments in the dental office. A lot of us that grew up in the 70s or 80s or 90s remember the foam that was placed in the mouth. Your dentist probably squirted some shaving cream looking stuff on these obnoxious plastic trays and made you hold them in your mouth for several minutes while you drooled and spit all over. That's one way. We have fluoride rinses that are essentially a mouthwash with a higher quantity of fluoride in it that you can swish or gargle with for seconds or minutes to expose the teeth to fluoride. Kind of the newest approach, and what most dental offices offer after your dental cleaning, is a fluoride varnish application. Essentially, this is a little bit of fluoride mixed in with some resin and a little bit of alcohol, not the kind that would intoxicate you. And what that does, when it's painted on your teeth, the alcohol dries and it creates a very sticky residue that kind of hangs out on your teeth for a period of several hours to days, depending on the product that your dentist is using. And this varnish with fluoride can actually deposit the fluoride into your teeth over the course of those hours or days, and again, help kind of replace some of the wooden studs with metal ones and create a strength in your teeth that is essential to preventing further breakdown. Most of these resin varnish fluorides are flavored and do a pretty good job at staying on the teeth. Your dentist or your hygienist is going to ask you not to brush for a period of several hours after the application. We actually want that to stick on your teeth for as long as possible so that you get all the benefits. But this is a product that's super easy, it's very efficient in terms of cost, and it's a great insurance policy. A lot of adult patients are like, I don't know if I need fluoride. The truth is most people will benefit. The risks are relatively zero. And the benefits can be great. If you have a crown or a couple of fillings, it's a good idea to get your fluoride application. If you're on any prescription medications, it's a good idea. Obviously, for young people, this can be effective. The American Dental Association estimates that about 25% of cavities are prevented by fluoride applications in the dental office. So, you know, it can be $15 or $20 or $25 for a fluoride varnish at the dentist, but that's certainly less than a copay of a single filling. So it can work to your advantage, both cost-wise, but also avoids the hassle and time of having problems that you need to have fixed. Now, that's not to say that fluoride will prevent any and all problems from cropping up, but it's a good adjunct to proper dental care in order to ensure that you have a happy and healthy smile.